Hello everyone, my name is Tita. I'm working with my partner Ariana, and we're going to be presenting today on pulse field ablation catheters and how to improve them. Okay, so this is just a little bit of an overview of our table of contents. First, we're going to be looking at the clinical background and problem that we're going to be examining with pulse field ablation catheters. Next, we're going to be looking at the current market. Then we're going to be looking at industry insights, talking to professionals. And then next, we're going to be looking at design and innovation. So these are going to be ways that we can improve the current technology that already exists for better patient outcomes. And then last, we're going to be looking at regulatory standards that would apply to these devices. So first of all, what exactly are pulse field ablation catheters going to be targeting? There's a condition called atrial fibrillation, also known as AFib. This is a cardiac condition where essentially there's an irregular rhythm of the heartbeat. So the heart is not beating as it normally should. This ends up producing a load of problems for the patient, and one of the ways that it is being addressed is through pulse field ablation catheters. So in terms of the impact of patients who have AFib or atrial fibrillation, it impacts about 10.5 million adults in the US, and it can lead to a number of the following conditions, which are pretty severe, including heart attack, stroke, and blood clots. It's often because it is a part of the body and anatomy that impacts so many other aspects of a patient's anatomy. It can also be linked with other conditions such as high blood pressure, heart valve problems, and coronary heart disease, all of which have very negative, potentially fatal outcomes for patients. The ways that the AFib is currently treated is through medication and sometimes surgical procedures. So we're going to be doing a deeper examination into these current solutions. Oh my God. So in terms of the industry need, as previously mentioned, AFib is most commonly treated with medication, but it's also treated with surgical procedures. Some of the surgical procedures include the Maze procedure, and the pulse field ablation catheter actually falls under this type of procedure, which is essentially where cardiac scar tissue is created intentionally by a surgeon through a surgical procedure. What this does is by creating cardiac scar tissue, it disrupts the irregular heartbeat electrical signals. So it's like kind of like two negatives make a positive. By disrupting irregular signals, it tries to essentially force the heart back into somewhat of a normal heartbeat rhythm. Some of the other contemporary medical procedures, techniques that are used for surgery to treat this condition include thermal ablation, which is where heat is applied to the tissue. However, there are many problems with many of these current conditions or current methods of treatment. So one of the issues with thermal ablation is that it can damage the surrounding tissue, and obviously since we're looking at cardiac tissue, which is heart tissue, damaging the surrounding tissue would be very problematic for the patient's outcome and quality of life. It also could lead to a lot of internal bleeding if improperly applied. Another common contemporary medical or surgical procedure used to treat AFib is cryoablation. However, one of the problems with this is that it causes a lot of cell damage, and it indirectly disrupts or just damages the surrounding cellular environment. Again, a problem when we're dealing with cardiac tissue because the heart itself is also surrounded by many anatomical features that need to be kept in working condition. A last surgical procedure that is used is radiofrequency ablation. Again, one of the issues with this technique is that it can cause burns and inaccurate tissue targeting. So again, we're working in a very delicate and sensitive area of the patient. Precision is key. Any damage to unintentional damage to surrounding areas could be potentially fatal for the patient. So these are some issues with contemporary procedures that need to be addressed. So this is where pulse field ablation catheters come in as a new and upcoming technology to sort of combat these issues and provide a surgical procedure that is targeted, precise, and will lead to a good quality of life for patients. Some of the current market competitors include Boston Scientific, Medtronic, Abbott, and Johnson & Johnson. So again, this is a very developing and new and upcoming field.
Sorry, what are those numbers? Is that the market cap for the company?
Oh, this is like how much they've invested and how much they've acquired capital from their investments in developing these devices.
Okay, please continue.
Okay. So yes, these are some of the market numbers for each of the specific companies, and also these images next to each of the company names are their specific devices that they're developing for pulse field ablation catheters. You can see each one is relatively unique in their design, as this is a new market where everyone is sort of trying to stake their claim on a piece of pulse field ablation catheters.
All right, so moving on to industry insights, we talked a little bit more about what the market's currently looking like and different companies that are trying to be kind of the main pioneers in the PFA catheter industry. So some professionals that we spoke to, just for some insight on their background. So we talked to individuals from Shockwave Medical, Boston Scientific. We also were able to talk with professionals who had around more than 20 years of experience or so in catheter ablation technology in general. So they were able to kind of see PFA technology as it was being developed, starting all the way back with this kind of, it's a little bit blurry, but this timeline through catheter ablation starting all the way from like the 1990s, 1970s. So some key takeaways that we were able to gain from our conversations and interviews with industry professionals was overall talking about like both the technological challenges, and then also regulatory challenges as well, moving through the FDA submission process and what exactly that would look like, especially as the catheter ablation technology kept on improving and kept on changing things. So to start off, first and foremost, one of the major technical challenges that we were able to gain insight from our interviews was overall just fitting sensors, irrigation, and 3D mapping all into a small catheter design. As we're aware, catheters are extremely small devices. It has to fit into the heart itself and fit into the body. So making sure that it's able to fit into the heart is extremely important. But if we're trying to include all of these different features like different sensors, an irrigation channel, 3D mapping technology, it can be relatively hard to do that on such a small surface area. And also we want to ensure that there's reliability and no leakage as well, which is important because we don't want to cause any further complications during the procedure. And also talking about regulatory hurdles. So there are different innovations that were made with catheter ablation technology. I know that my partner touched on different ablation techniques that are currently used to mitigate or treat AFib. But overall, when it first started out, there were some issues with like the temperature. It was too hot, it was scarring the tissue. So they wanted to create like an open feed, like open loop irrigation channel. But because of kind of the strict guidelines and FDA scrutiny, even if they had the correct data from past technology or current devices they had, with any sort of innovative design or innovative idea that they wanted to add on to their current design, they would basically have to start from scratch. So that required new testing protocols and collecting new data, which could set back a company for a couple years. And then also, when it comes to addressing those regulatory hurdles, something that they mentioned was overall making sure that you're able to prototype early on. So being able to run early stage material and design those tests in parallel really can help save efficiency and significant development time, especially as we've seen through this course that it can take 4 or 5 or 10 plus years even to get a new and innovative device up and running on the market. And then also we discussed some technology trends as someone who has been able to experience and witness the 20 plus years of catheter technology development. We asked basically what are kind of advancements that they're looking towards, and just overall focusing on faster and more accurate cardiac mapping was a key thing that these professionals were able to kind of touch on or are looking forward to seeing improvements on in the future. And not just with PFA catheters, but catheter ablation technology in general. And then overall also reducing the procedure time. And then also another question we asked was, what advice would you give someone if they were interested in entering the catheter ablation technology field? And they overall just talked about getting hands-on experience, attending conferences, networking, and then being able to expand your network and learn more from current leaders in this field would be very beneficial if you're interested in being involved in this field in the future. So overall, going into the foundational design of PFA catheters, there are a couple of different design elements which are listed here, and we wanted to include like a brief description and then also how they kind of align with regulatory standards. So first and foremost is the electrode configuration. In the previous slide, we were able to see different catheters from different companies and how their electrode configuration varied. There were different shapes, different sizes, So overall, what the main component is having that multi-electrode array at the end of the catheter. It could be circular or lasso, what we saw that flower design from Boston Scientific. And overall, this electrode array design is supposed to, is optimized for circumferential PV isolation. And this would fall under the device description in terms of regulatory alignment. Basically just talking about the ablation strategy and the contact geometry. And then for all of the design elements, there's also the energy delivery. So basically how exactly the pulse field energy is administered during the procedure, and how it's supposed to specifically ablate myocardial tissue. So that's a key factor, or that's a key component for PFA catheters especially. And that would go into bench testing from what we're going to see with regulatory alignment, just making sure you're able to go through the correct electrical testing and making sure that it's not giving out too much of a strong voltage that it could damage like a surrounding tissue, but it's basically giving the right amount that'll be able to ablate the affected tissue. And then also we focus on tissue selectivity is also a key design element, making sure that cardiac cells are ablated and that surrounding tissue when the catheter is going through the body is not affected. And this would be in summary of clinical studies, so making sure that it is a safe device, which would fall under it, this is where it would fall under our SSED. And then also catheter navigation, so being able to steer the catheter throughout the body is super important as well, and steer it throughout the heart as you're treating the patient. It usually has a deflectable tip, and we have further images and diagrams later on in our presentation which depict this, and making sure that it's compatible sheets for transseptal access as well. And this would also be encompassed in the device description. And then visualization, this is something that we kind of touched on. So one of the key innovations for PFA catheters in recent years is making sure that it has radiopaque markers and that it's integrated with 3D mapping systems. One notable one is the Cardo mapping system with Johnson & Johnson. And this is external compatibility, just because the actual catheter device itself would be working alongside this catheter mapping system, so it wouldn't be necessarily encompassed in the actual device itself. It's something that would be separate. And then also contact assessment, making sure that there's some systems include contact force or impedance sensing, and this varies by each model. And this would be towards risk management, just because we want to make sure that the impedance sensing is fitting for the specific device. And then also the deployment mechanism is extremely important as well. If it has self-expanding splines or mesh for consistent contact with the vein. This would be under bench testing when you're testing the device after developing those prototypes, and also having a friendly user interface when you're using it with like a mapping guided or console-based control of energy delivery. And this could be seen with like the Cardo mapping system, so that would be software validation. And then lastly, something that's kind of a standard for all medical devices is just that sterilization and biocompatibility piece. So making sure that this device is biocompatible is extremely important, and one of the key regulatory standards that all medical devices have to abide to, especially this one since it's being inserted into the body.
All right, so next we're going to look at the strengths and weaknesses currently with pulse field ablation catheters. Many of the strengths that they have also, because this is a relatively new field in terms of application, applying pulse field ablation catheters to ablating cardiac tissue. There are also some potential areas that should be improved upon in order to better improve patient outcomes. So again, one of the biggest, draws you could say of using pulse field ablation catheters for cardiac tissue specifically is that it is very selective in the tissue that it ablates. So it is able to, as compared to other contemporary surgical procedures, it is able to actually target cardiac myocardial cells with minimal collateral damage. This means it doesn't damage the surrounding tissue that surrounds the heart, which is very good because, as previously mentioned, there are a lot of really important things that surround the heart that should remain safe and untouched. However, because this is very selective in the tissue that it ablates, one of the issues that the industry is seeing with pulse field ablation catheters with cardiac tissue is that it may not be as effective with scar tissue. So if there's any scar tissue with patients who have prior cardiac conditions, it may be harder to ablate those tissue cells and may lead to a less effective surgical procedure. Another issue that we wanted to look at was procedure time. So again, one of the strengths of pulsed field ablation catheters for use in cardiac tissue is that it could potentially be faster when ablating. However, there's a lot of limited data on this. Again, using pulsed field ablation catheters for cardiac tissue is a relatively recent development in pulsed field ablation catheter technology. And so further testing, further study, further data is needed to ensure that not only is the procedure time and ablation time shorter, it's also doing so in an effective and safe way for the patient. And speaking of safety, one of the other things was the overall safety profile of the pulsed field ablation catheter. Again, the way ablation works is that it essentially burns the cardiac tissue cells in order to kill them, and this could also potentially be damaging to surrounding tissues. Again, pulsed field ablation catheters are targeted in the cells that targeted in the tissue types and cells they are able to ablate. But because this is new and recent and upcoming, we just really want to make sure that there is always still a risk for potentially damaging the cells around the heart, and we just want to make sure that risk is fully mitigated. And then again, the energy delivery, it's non-thermal and it doesn't depend on contact. However, because of that, it requires really specialized technology that not all hospital infrastructures may have, and so that may be harder to integrate for infrastructures that aren't already equipped for that. And then again, regulatory approval, because as we keep mentioning, this is a relatively new field of development. Making sure that all of these devices and their technologies are up to par with regulatory standards is really, really important in making sure that these procedures are safe for patients. And then next, having previously mentioned the potential areas that we can improve upon, we're going to be looking at some of potential design innovations to improve the already existing and developing technology of pulsed field ablation catheters for use in cardiac tissue. The first design is a little bit of like a combination device where it essentially combines multiple aspects of treating AFib, which is the clinical need. One of the first component of it would be drug elution. So as previously mentioned, AFib traditionally has been treated with medication, and so we could potentially combine medication with the pulsed field ablation technology, because what the medication does is it helps control the heartbeat rhythm. It controls the irregular heartbeats to sort of make them more normal. And this would be nice because depending on the patient, this could be customized to their needs and their medical history. So depending on what their anatomy requires, this drug combination could be tailored specifically to a patient to better ensure efficacy and outcomes. Another potential combination within this device, component within this combination device, would be an impedance sensor, which would essentially be a sensor integrated into the catheter device itself that would sort of inform lesion ablation progress without the need for imaging. So because the catheter is put up into the body and there's a need for essentially the area and anatomy to be imaged while the procedure is happening, this would sort of prevent or reduce the need for any really complicated 3D imaging that would need to take place during the procedure. This sensor would make it so that while moving around within the body, within the patient's body, the surgeon would be able to tell what it's doing, where it's going, without the need for like super complicated imaging that may end up failing during the procedure and could cause a lot of problems. And then a final component of this device would be antimicrobial electrode coating. So this is just really like a catch-all to make sure that while the catheter device is being applied to cardiac tissue, there's no potential for infections that may cause later harm to the patient.
All right, and then on to the, it's kind of covered a little bit. But onto the second kind of innovative design, we touched on a wireless and self-expanding device, which has a couple different components, and I'll go through each one. But the first and the main one is self-expanding electrodes. So these self-expanding electrodes would be incorporated into the device, which you can see this kind of image for the PFA with the self-expanding electrodes was, this image was created utilizing ChatGPT, or the new EDU model that we have access to as SJC students, just to kind of be able to visualize what exactly, or the different components that I'll be talking about as I go through this presentation. So we wanted to incorporate these electrodes to basically be able to conform to a patient's specific anatomy. Each heart looks different, each patient's heart it has different crevices, and that's why we have the new 3D mapping technology, or like the Cardo system, for example, with Johnson & Johnson, that is able to maneuver through a patient's specific heart, and to be able to provide like the most accurate information, so the procedure can move through very efficiently, that we're able to target the specific areas that are affected and not impact any of the other healthy tissue surrounding the the affected tissue that needs to be ablated. And this could overall improve tissue contact, just because it would basically mitigate the need to have to like maneuver very carefully and like strategically place the end of the catheter on the certain tissue. If it were to self expand, it would basically allow medical professionals, to be able to kind of contact that tissue head on, and also reduce repositioning, just because it'll already self expand to this affected area of the tissue that it needs to ablate. And then also wireless electrophysiology lab connectivity. This would enable real-time data transfer to mapping systems and displays instead of having to be connected with a bunch of different wires. It can overall improve the workflow and allow for more ergonomic and cable-free procedures. I haven't personally been in an EP lab when this procedure is happening, but from looking at through different research and being able to identify like different workflows and everything, especially looking at Johnson & Johnson and like the Cardo mapping system, there's a bunch of different wires that are connected through the catheter, through the machine, and they do require someone to be in that space from Johnson & Johnson to be able to work through that workflow, which could overall make it a little bit more stressful in that, or a little bit more stressful in that space where you have a bunch of different medical professionals there at the same time, and then also someone from an external company or outside of the hospital from Johnson & Johnson who has to be there to really go through that machinery. And then also we wanted to incorporate real-time adaptive energy delivery, so it would adjust the pulse parameters based on tissue impedance feedback to optimize lesion formation and enhance overall procedural safety. A couple different things are also precision contact sensing, so providing accurate detection of the contact force and tissue proximity. This could overall just improve ablation effectiveness as a whole and reduce any variability between different points in time when the catheter is being used. And then a couple different things, so balancing and corrective energy distribution, so maintaining a uniform impedance across electrodes and auto-correcting any misalignment for consistent energy delivery. So this, a part of like the past 2 points I touched on, is really just making sure that we're able to improve on impedance feedback and then also on energy distribution. And then lastly, seamless mapping system integration. So being able to develop a device that's fully compatible with leading EP platforms. So the Cardo mapping system, other systems developed by different companies which may have different input requirements, that would be really helpful, especially say a hospital or 5 hospitals were to invest in this specific device, but all 5 hospitals have a different mapping system for the PFA or catheter ablation tech. Instead of having to purchase a different device that fits each of those systems, being able to create this universal universal integration system within this device could really help mitigate costs for that specific, or for all of those hospitals. So this can streamline overall clinical workflows and minimize setup complexity as well. And then going into the market analysis, so we talked about the different innovations that have been made with PFA catheter technology. We touched on the different kind of the big giants in PFA catheter tech with Boston Scientific and Medtronic. But as we're looking through this specific market, we can see that there is rapid market growth. So the PFA or PFA catheter tech is expected to grow at a compound annual growth rate, or CAGR of around 25 to 30% over the next 5 years, just due to rising atrial fibrillation prevalence within the U.S. and then also procedural efficiency. So as these procedures are continuously improved on, and we can see that unfortunately heart disease is a leading cause of death in the U.S. And as we see AFib occurring more, that's just basically more demand for this device to be improved on. And also FDA approvals are also gaining momentum. As mentioned earlier, Medtronic's Pulse Select, Boston Scientific's FARAPulse, they both have received FDA approval, which basically is setting the stage for wider clinical adoption. So as mentioned from like the industry insight, when it comes to having these innovative designs and adding on these innovative changes to catheter ablation technology as it currently stands, it requires a lot of additional testing and basically kind of having to start from scratch. But because now we have different giants on the market like Pulse Select and FARAPulse, this sets a precedent for any future designs to kind of be able to reference that and reference those FDA submissions. So basically kind of jumping over those regulatory hurdles because these companies have already done so. And then there's also clinical demand shifting to PFA as well. So electrophysiologists increasingly favor PFA, although it is a recently developed technology because of its non-thermal safety profile and overall shorter procedure time compared to the other techniques that were mentioned. This is the type of technology that is preferred to treat AFib compared to all of the other techniques. So there is a higher demand from the clinical side and clinical side as well. And there's also a competitive landscape as well. We were able to see 4 different giants in the market that are trying to be the main focus point for PFA catheter technology. And we can see like Medtronic, Boston Scientific, already 2 huge medical or healthcare companies emerging. And then there's also different smaller companies like Genevolve and Ablicon. The innovation race is basically focusing on that mapping integration and safety enhancements, but we can see that there are different competitors and different companies entering into the field trying to enter this market and make sure that they can stand out as someone in this market, just because we can see that it's growing at such a rapid rate. And then also there are some barriers to entry as well. So while there are a lot of positives and there is a huge need on the clinical side in terms of PFA catheter technology, there is still high regulatory scrutiny, which we actually were able to identify through even meeting with industry professionals in general. And this encompasses clinical trial costs as well, which can be very costly, especially with this sort of technology. It's not something that you attach to the skin, or it's not like a drug, but it's something that is a more complex procedure than other devices. And then also the interoperability demands with existing EP lab infrastructure. So there are already currently existing electrophysiology labs across the country. So making sure that any future devices can still can integrate seamlessly with that current infrastructure is important, just because having to make additional changes to existing infrastructure is also very costly and timely as well.
All right, so we're going to just wrap it up with some regulatory guidelines that PFA technology has to adhere to. As previously mentioned, there are a lot of regulations that this technology needs to go through to make sure that it is safe for patient use and also improves the patient outcomes. One of the first, getting it out of the way, is the regulatory requirements for pre-market approval. So because pulse field ablation technology is classified as a class 3 device, the highest rating of medical devices, it has to go through pre-market approval. And this means it has to be completely approved before it can be released to the market because of its high potential for risk and danger to a patient. Also, the standard regulatory guidelines that most medical devices have to go through also apply to PFA technology. So things like design controls, making sure that the quality of the device overall and the technology being used is properly documented, and also that risk is being assessed and also mitigated before it's going out to market, because this is a potentially dangerous device. Also making sure that the design is verified and validated to make sure that it is actually going to do what it says it's going to do, and actually improve the quality of life for patients and improve the surgical efficacy for treating AFib. Also, because this is an electrical device, it does need to adhere to electrical safety regulations, so this would be IEC 60601. And then also, as previously mentioned, this is a device that has a high risk potential, and so it needs to go through ISO 14971, which is the risk management safety guidelines, international safety guidelines, to make sure that it does not pose any unnecessary risk to a patient while in use. And then also, of course, because this is used within the patient's body, biocompatibility standards, ISO 10993 also need to be adhered to very strictly to make sure that it will be safe for patients for use within the body. And that is it. Thank you.